Gentlemen, if you're a man over 60 and you've been quietly wondering why things just aren't working the way they used to down there, I want you to stop whatever you're doing and give me the next few minutes of your attention. I'm Dr. Grace Holloway, and I've spent more than 20 years as a urologist here in the States, sitting across the desk from thousands of men just like you. And today, I'm going to walk you through something I wish every one of my patients had learned decades ago. It's a simple 3-minute daily routine that can genuinely help you reclaim your erectile strength, your confidence, and a whole lot of your vitality. No pills, no gadgets, no expensive clinics, just your own body done right. So stick with me because I'm going to explain exactly what to do, how to do it, and most importantly, why it actually works. Welcome back to the channel, everyone. Let me start by saying this. In all my years in practice, I've learned that a man's confidence walks hand in hand with his overall well-being. And yes, sexual health is a huge piece of that puzzle. It's completely normal, and I mean completely normal, to notice changes in erectile function as you get older. And let's be honest with each other. A lot of you feel frustrated. Some of you feel embarrassed. Some of you have stopped bringing it up with your wives or your doctors altogether. I've seen it 1,000 times. But I want you to hear me loud and clear right now. You are not alone in this, and there are real concrete effective steps you can take starting today. See, a lot of things play into erectile function as we age. Your blood pressure, your blood sugar, your heart health, your stress levels, even some of the medications you might be taking for everyday conditions. It's a complex interplay of your vascular system, your nerves, and your hormones, all working together. And today, I want to introduce you to a foundational piece of male pelvic health that, in my experience, gets overlooked way too often. I'm talking about your pelvic floor muscles. Think of them as the unsung heroes of the male body. They support your bladder, your bowel, and yes, your erectile function too. When you strengthen these muscles with the right simple exercises, you can see real improvements in blood flow, nerve function, and overall erectile quality. Now, I need to be straight with you about one thing right up front, because I know what the title of this video might have you thinking. This is not about changing your anatomical size. That's not something any exercise in the world can do, and anybody who tells you otherwise is selling you something. What this is about is maximizing the hardness, the fullness, and the performance of what you already have. It's about making sure those vital systems are firing on all cylinders, so that when it matters, your body shows up the way you want it to. And for most men I treat, that difference is night and day. So let's get right into it. The exercise I'm talking about is commonly known as the Kegel exercise. For years, Kegels were mostly talked about for women, especially after childbirth. But gentlemen, I cannot stress this enough. They are absolutely vital for men too, especially for things like urinary control, prostate health, and what we're focused on today, erectile strength. I've watched men in their 70s come back to my office 6 weeks after starting these, and the smile on their face tells me everything I need to know. The first step, and this is where most guys go wrong, is correctly identifying the muscles. This is critical because if you're clenching the wrong parts, you could do this for a year and get nothing out of it. It's simpler than you think, though. Here's how I explain it to my patients. Imagine you're trying to stop the flow of urine midstream, or imagine you're in a crowded elevator and you really need to hold in some gas. The muscles you squeeze and lift in those moments, those are your pelvic floor muscles. They run from your pubic bone back to your tailbone, forming a kind of hammock at the base of your pelvis. Now here's the common mistake. A lot of guys will tense up their abs, their thighs, or their glutes instead. Don't do that. I want you to picture it as a subtle internal squeeze and upward lifting sensation, almost like you're zipping something up from the inside. You can try it while sitting in your recliner, lying in bed, or standing at the kitchen counter waiting for the coffee to brew. Once you've found them and you're confident you're isolating them, you're ready to start the routine. And I want to say something here that came up a lot in the comments on my last video. People kept asking, "Doc, how long until I actually feel something?" So let me give you a real answer based on what I see in my practice. Most of my patients start noticing small changes, better control, a little more firmness, in about 2 to 4 weeks of consistent daily practice. Real noticeable improvements in erection quality usually show up around the 6 to 12 week mark. And by 3 months, if you've stuck with it, you're going to know. Your wife is going to know, I promise you that. But it only works if you do it every single day. Consistency is the whole ball game here. All right, let's talk about the 3-minute daily routine. This thing is designed to be quick, easy to fit into your day, and genuinely effective. 3 minutes, once a day, you can do it anywhere. At your desk, in your car, at a red light, sitting in your easy chair during the evening news, waiting in line at the grocery store. Nobody will ever know you're doing it. And like any muscle in your body, your pelvic floor needs regular exercise to get stronger and work the way it's supposed to. Step 1 is what I call the slow hold, and it takes about 1 minute. Gently contract your pelvic floor muscles, lifting them upward. Hold that contraction for 3 to 5 seconds. Really feel the squeeze. Then, and this part is just as important, relax completely for the same amount of time. Don't rush the relaxation. That full release is critical for proper blood flow and muscle recovery. Repeat this 10 to 12 times. This step builds your baseline endurance and your control. Think of it like the warm-up set at the gym. Step 2 is the quick flick, and this one also runs about a minute. This is all about speed and responsiveness. You're going to rapidly contract and relax your pelvic floor muscles, kind of like flicking a light switch on and off as fast as you can while still feeling each one. Quick squeeze, full release, quick squeeze, full release for about 60 seconds straight. This is the one that trains your muscles for the quick reflexes you need for firm erections. Think of it as the sprint work for your pelvic floor. Step 3 is the endurance hold, and again about 1 minute. This is where we build lasting stamina. You're going to contract your pelvic floor muscles and hold for as long as you comfortably can without holding your breath. Start with 10 to 15 seconds if that's all you can manage. And trust me, for a lot of guys, even that is tough at first. Then fully relax. Repeat 3 or 4 times. Over the weeks, you'll find you can hold longer and longer, and that's the sign your muscles are actually getting stronger. This step is the one that really strengthens the pelvic floor for lasting sustained performance. And that's it. 3 minutes a day. It sounds almost too simple, and I get that. But I'm telling you, the power is in the consistency and the correct execution. Cut corners on either one, and you won't see the results. Now let's talk about the why, because I know a lot of you want to understand what's actually happening inside your body when you do this. How does squeezing some internal muscles translate into a harder erection? Well, this is my favorite part to explain, because once you get it, you'll never look at these exercises the same way again. It all comes down to 3 things: blood flow, nerve health, and something we call venous occlusion. When your pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus muscles, if you want the textbook names, when those are strong and well-toned, they act like a powerful pump. Here's what happens during an erection. Blood rushes into the spongy tissues of the penis. That's the arousal part, and that's what most guys focus on. But here's what they miss. For a truly firm, lasting erection, that blood has to be trapped there. It can't just flow in and then flow right back out. Your pelvic floor muscles play a critical role in compressing the veins that normally let blood leave the penis. That's venous occlusion, and it's the secret sauce behind firmness and duration. A stronger pelvic floor means a more effective blood trap, and a better blood trap means significantly improved firmness and the ability to sustain that erection through the whole act. It's like building a stronger foundation for a house. Everything sitting on top of it performs better when the foundation is solid. On top of that, these exercises improve nerve sensitivity and coordination throughout the pelvic region. I like to think of it as fine-tuning an old guitar. Better nerve function means better sensation, better control, and a more responsive erection when you actually need it. That translates into not just firmness, but improved climax and overall satisfaction. Your wife will notice the difference too. And while we're not talking about anatomical size, the combination of better blood flow, enhanced firmness, and tighter control absolutely leads to a fuller, more optimal erection. One that feels more substantial and performs the way nature designed it to. You're getting the most out of what you've already got. Now, the benefits go way beyond the bedroom, and this is something I want my older patients to really understand. Strong pelvic floor muscles help with better bladder control. That means less of that annoying dribble after you finish urinating. Less of that sudden, I gotta go right now urgency that makes you scope out every bathroom when you're shopping at the mall. They can also help significantly with premature ejaculation by giving you more control over the whole process. So this is a total win for your health and your everyday quality of life. not just your love life. I also want to address a few questions I get asked a lot in my practice, because I know some of you watching are in special situations and you're wondering if this even applies to you. First, for the men who've had prostate surgery, whether that's a radical prostatectomy or a TURP procedure, yes, these exercises are still beneficial, and in many cases, they're even more important. Your pelvic floor has to work a little harder after surgery to compensate for the changes in your anatomy. But I always tell my post-surgery patients, please check with your own urologist first about when it's safe to start and how aggressively to do them. Everybody heals on a different timeline. For those of you managing diabetes, high blood pressure, or taking medications that affect circulation, these exercises are still a great tool, but they work best as part of a bigger picture. Keep your blood sugar in check, take your meds the way your doctor prescribed, and don't skip those annual physicals. The Kegels will do their part, but they can't do everything. Now, while these exercises are simple, it's really easy to make a few mistakes that can ruin your progress or even cause some strain. Let me run through the big ones. Mistake number 1, bearing down. Don't push downward. You're trying to lift and squeeze upward, not strain down like you're trying to have a bowel movement. This is one of the most common errors I see, and it can actually weaken the muscles over time or cause other problems like hemorrhoids. Not worth it. Mistake number 2, holding your breath. I see this constantly. Guys get so focused on the squeeze that they forget to breathe. Breathe normally and naturally throughout the whole routine. Holding your breath increases abdominal pressure, which is counterproductive and puts unnecessary strain on your body. In through the nose, out through the mouth, nice and easy. Mistake number 3, recruiting other muscles. Focus only on your pelvic floor. Don't tense your abs, your glutes, or your thighs. If you feel those muscles working hard, you're doing it wrong. This exercise is all about isolation. Put a hand on your belly if you have to, just to make sure it's not tightening up. Mistake number 4, overdoing it. I know. You guys hear 3 minutes a day, and you want to jump to 10 minutes because more must be better, right? Not with this. More is not always better here, especially when you're starting out. Stick to the 3-minute routine daily. Overtraining can lead to muscle fatigue, soreness, and even pelvic pain that sets you back weeks. Patience wins this race every single time. And finally, a non-negotiable point from me as a physician. While Kegels are incredibly beneficial and a fantastic tool for both preventative and supportive health, they are not a magic bullet for every issue under the sun. If you're dealing with persistent erectile difficulties, severe urinary problems, pain during erections, blood in your urine, or any real discomfort in your pelvic region, please go see your doctor or a urologist right away. There could be underlying conditions like heart disease, diabetes, nerve damage, hormonal imbalances, or prostate issues that need professional medical attention. Self-treating serious conditions is dangerous, and early diagnosis is always your best shot at a great long-term outcome. I've seen too many men wait too long out of embarrassment. Don't be one of them. Your doctor has heard it all before, I promise you. Now, here's something I want to add that I don't think enough doctors talk about. These exercises work best when they're part of a bigger lifestyle picture. I'm not going to pretend that Kegels alone will fix everything if the rest of your habits are working against you. So let me give you a quick rundown of what I tell my own patients here in the clinic. Number 1, watch your diet. You don't need to go on some crazy restrictive plan. Just lean toward the Mediterranean style of eating. Lots of vegetables, fruits, whole grains, olive oil, fish, nuts. Less red meat, less processed food, less sugar. Good blood flow down there starts with good blood flow everywhere, and that starts with what you put on your plate 3 times a day. Number 2, move your body. You don't need to become a marathon runner. A 30-minute walk after dinner, 5 or 6 days a week, works wonders for cardiovascular health, which directly supports erectile function. If you enjoy swimming, biking, or lightweight training, even better. Number 3, sleep. I cannot overstate this one. Your body produces testosterone while you sleep, and poor sleep absolutely tanks your hormones over time. Aim for 7 to 8 solid hours. If you think you might have sleep apnea, and a lot of older men do without knowing it, get a sleep study done. Treating sleep apnea has been a game changer for a lot of my patients. Number 4, manage your stress. Chronic stress wrecks your hormones and your blood vessels. Find what works for you. Time with the grandkids, fishing, gardening, woodworking, church, whatever keeps you grounded and happy. And number 5, limit the alcohol and quit the tobacco if you haven't already. I know those are tough ones for a lot of men my age and older, but your circulation will thank you, and so will the rest of your body. When you combine the 3-minute Kegel routine with these lifestyle basics, you're stacking the deck in your favor in a big way. I've had patients in their late 70s tell me they feel better and more confident now than they did in their 50s. And it all started with a few small daily habits. Gentlemen, taking charge of your health, even the parts we don't always talk about out loud, is one of the clearest signs of strength and self-respect I know of. This 3-minute daily routine is a simple but incredibly powerful way to invest in your long-term erectile strength, your vitality, and your overall well-being. It's about building a foundational habit that supports you in all the areas of your life, from the bedroom to the boardroom to the golf course on Saturday morning. Remember, these exercises work best as part of a holistic approach to your health. Combine them with a balanced diet, regular cardio, good sleep, and some stress management, and you're giving your body everything it needs to perform at its absolute peak for years to come. If this video today has given you some hope or some practical tools you can actually use, here's how you can keep this momentum going. Hit that like button right now if you learned something useful. Subscribe to the channel and turn on the notification bell so you never miss the practical science-backed tips I put out every week specifically for men's health after 60, and drop your questions or comments down below. I read every single one, and honestly, your questions and stories are what inspire most of my future videos. Here's what I want from you in the comments today. First, tell me what part of this was most helpful. Second, if you're going to start the 3-minute routine, tell me you're committing to it. Put it in writing for yourself. Come back in 2 weeks and let me know how it's going. I'd love to hear your progress, and I bet the other men watching would love to hear it too. That kind of community is powerful, and it helps everyone who stumbles across this video down the road. Thank you so much for spending these few minutes with me today. In my very next video, I'm going to tackle another vital topic: navigating prostate health after 60. When should you get screened, what the latest guidelines really say, and what every man over a certain age needs to know to protect his prostate. I'll clear up the misconceptions, the fear-mongering, and give you the straight truth from 20 years in the field. You absolutely won't want to miss that one. So make sure you're subscribed. Until then, stay informed, stay healthy, and keep taking charge of your well-being. This is Dr. Grace Holloway signing off, and I'll see you in the next one. Take care of yourselves, gentlemen.